And a very pleasant good Tuesday afternoon. Gabe Farias and Dr. Danirl H. Kellum. It's time for the KellumMD video podcast. Dr. Kellum, we hadn't done these in a couple of weeks.
I know.
It's always great to talk with you. How are you doing?
I'm doing Gabe. How are you?
You're doing Gabe?
You know, Gabe.
You can't stop looking at my pink shirt, right?
It's like Pepto-Bismol.
That's what my son says. He said, Dad, you look like a giant Pepto-Bismol.
Makes me nauseated. Just
Mira, it's got the K. Where's the K at? Look at that. We're branding.
Nice.
We're branding, right? Dr. Kellum, speaking of branding,
Yeah.
I could not be prouder of what we've done out here. And I love it when I say you've done, and you were always quick to say, no, it's not me, it's all of us. And that's our brand new 22,000 square foot building at 3701 FM 3009 in Schertz, Texas. What a beautiful building. What a beautiful medical facility for people to get care.
Wow, Gabe, you know what? We're super excited to be here, and it is a beautiful thing, and it is true. I'm one small cog in this big wheel that's moving us towards this, and so we're glad to be in. It's a wonderful blessing for us. You know, a lot of people have worked a long time, including yourself, to make this happen, and so we're just very happy that we're here. We're able to serve the community, and we'll be a nice resource for people.
Yeah, and of course we have a new website now, KellumMD.com. It's the name of this podcast, KellumMD.com. Visit KellumMD.com if you want to set up an appointment at any of our facilities here in Bergheim. Dr. Kellum, your brother's OBGYN clinic in Westover Hills, KellumMD.com. Great website. It's really simplified things for us.
It has. First of all, just spelling it has made all the difference.
Yes, it
in
has.
the world, for sure.
We've gone from the longest email
Yes,
addresses in the
it's
history of email
ridiculous.
addresses.
Having to tell people that is very brutal.
Yeah.
But the nice thing about my brother, just mentioning that, it's going to be good. He's going to be out here one day every other week. So one Thursday afternoon every other week. So we're going to be able to start by extending OB-GYN care out in this area. So we're very excited about that. And glad to have him here on board with us.
You know, right now, obviously we've opened up this new clinic here, 22,000 square feet, 11,000 of which we are taking for a new Kellum Family Medicine practice. You know, we're coming off of COVID, and I know you and I talk about this all the time. Allergies are crazy. You hear my voice right now. I know I don't have COVID, but it can be a bit misleading to folks who think, wow, I've got a scratchy throat. I've got a little bit of a fever. You know, what can you as a provider tell folks if they're feeling bad? It may be simplistic, but what would be your response for that?
Well, I mean, it seems relatively simplistic, but I will tell you, it's been something that's really plagued people over the last few months. We saw a huge spike in COVID, December, January, February.
Yeah.
Everything got a little bit better, and then came June, July, first part of August, we saw a resurgence of that. And most of that is dissipated to a great degree in our community. One of the things we see a ton of this time of year is ragweed, and so ragweed comes on with nasal congestion, sore throat, cough, sometimes some wheezing. It's very much similar to what we're seeing in terms of the COVID presentation. And so one of the things I would say is if you're having symptoms, get tested, because that's the very first place that we need to start.
And rapid test versus PCR test, what do you recommend, and how does that work?
You know, the rapid test is good because within 15 minutes you're going to get an answer. So we can begin treatment or at least mitigating risk as quickly as possible. The PCR test is good. I think the technology for rapid testing is sufficient enough for us to get an answer. We're going to look at getting a 1-hour PCR test. So that's one of the things that I think will be helpful to the community as well. But getting tested, home test, coming to the office, look, and then, you know, subsequent PCR testing if we need to is the very first step in helping us understand what we need to do.
Yeah, and if you need to talk to somebody, call us 210-945-2121 or visit us at KellumMD.com. People ask me, and of course I tell them I only played a doctor in my off-Broadway all-male docs and gals back in the day. But what do you tell people that say, I know, think about it.
I can't.
The all-male review of docs and gals. What do you tell people when they say, should I still get the vaccine? You know, it's been so long. Should I get a booster? What do I do?
You know, that's been a difficult question, I will tell you, and there's a lot of controversy laced around that, I will say. I am still a firm believer that the vaccine has made a difference in terms of minimizing hospitalizations and deaths. And what we're starting to see now, and it should have been released as of September 12th, is the new Omicron variant of both Pfizer and Moderna. Pfizer recommended for 12 years and above, and Moderna for 18 years.
So there's an Omicron variant vaccine. Okay.
There's one that specifically adds the BA4 and BA5 spike protein variants to the original vaccine, and so it's a much more targeted vaccine to the things that we're seeing in this particular generation of the virus. But I think it's a very helpful thing to do. The problem, I think, or the question for most people is, when do you get it? And so with many people getting the COVID infection again in June and July, I think it's recommended. It certainly is recommended 2 to 3 months after that infection. My personal feeling is if you wait 6 months, so if you had it in July, probably more November and December is a more effective time period for that. But I certainly think that it's helpful to continue to be protective. We know that it doesn't create as much protection as we initially thought from getting the disease or spreading it to other people. But what I think has really been vindicated is the fact that it does help protect against hospitalizations and deaths. And so I urge people not to look at it as a common cold. I really would hope people take it as serious as they always did. But we now have new treatments and effectiveness against the variant that renders it a little less problematic in terms of death and hospitalizations. But it's really important if we treat it and catch it early to minimize some of the post-COVID issues that we're seeing.
And really, it's if you feel bad, give us a call.
Absolutely.
Give us a call, 210-945-2121, or visit us online, KellumMD.com, because information is so helpful in these situations.
Absolutely. And it's nice, and we certainly like when people call. We can walk them through that. We can give them some affirmation on what's going on. We can test them, quickly get them in and see if there's an issue and begin any kind of intervention that we need, whether it be some of the antiviral pills or some of the infusions that are available, and that we can get into at a later time. But I certainly think knowledge and recognition of what's going on in one's particular medical situation is super important.
All right, Dr. Kellum, awesome. Thank you.
Yeah,
Man, look at you. It's like we haven't missed a beat.
I know. I hate to say we're connected like that.
So quick on-the-spot question. UTSA, UT score. Come on, man. I'm putting you on the spot. This is live, not really live television right now.
42-14, Texas.
You think UTSA and Jeff Traylor is going to beat Texas 42-14?
The other year.
Oh, right. Okay.
Although I will tell you, it wouldn't be surprising if they.
I tell you what, UTSA is a for real college football program.
Wonderful representation of our city, and they do a really great job. It's going to be an interesting game.
How good is Texas football in that 35 corridor from San Antonio to Austin? Now it's great.
It's amazing, isn't it?
Yeah, it is.
It's probably best in the region.
I agree with you. All right, Dr. Kellum, thanks so very much.
Thank you.
All right, folks, take care. Have a good one.